Hello students, welcome to Pharma Syndrome YouTube channel. I hope you are watching all our videos and you are getting knowledge and you are feeling excited as well as euphoric. And definitely, it's my passion always giving a good education lectures to my students. And thanks to all my subscribers. And please subscribe to our channel and like, comment, share. So I hope mostly you are liking our videos. So please give your comments and follow our Pharma Syndrome YouTube channel for the daily updates. And anyway, let's welcome to today's session, that is Autocoids. So in general, we are also called as Autocoids. So let's see what are these Autocoids. Okay, so here Autocoids. So regarding Greek terminology, this Autocoids is in the two terms. One is autos, nothing but two words. One is akos. So what is the meaning generally? This autos, akos. So autos means self and akas means relieving substance or remedy. So based on these two words, the meaning is self-remedy. Autocoid means self-remedy, self-healing. Okay. So based on the definition, autocoids are biological factors which acts like local hormones, have brief duration, only short half-life, and acts near the site of synthesis. Means here, for example, endocrine hormones. So they have to release from the hypothalamus, that is posterior or anterior pituitary. From the pituitary, they have to travel through bloodstream to show their action. For example, aldosterone. Aldosterone will comes from the endocrine hormones, nothing but endocrine glands in the CNS. From there, it travel through bloodstream and shows the action in kidney. So there is a distance, large distance between the hypothalamus, pituitary as well as kidney. So here they traveling some distance, but here local hormones, they synthesize it locally and they produces action locally. For example, every organ having their own autocoids, their own local hormones, and they synthesize, they release and produce action locally. So this is the regarding autocoids, their meaning as well as autocoids definition. So in body, there is a number of autocoids are there. In body, there is a number of autocoids are there. In that number of autocoids, for our understanding purpose, we have to go through some only. So the examples like routinely we are going through in the pharmacology. Maybe routinely we study in the pharmacology. Like the mnemonic is PK has pen. The example regarding mnemonic is PK has pen. So here is the mnemonic PK has pen. So let's we will go through the discussion. That is prostaglandins. PE based on mnemonic, P is prostaglandin. So prostaglandins are nothing but first they identified as a secreted from prostate gland, so named as prostaglandins. So prostaglandins are having different actions on the different tissues. Next, kinins. So kinins also one of the autocoids present in the body. Next, histamine. You mostly know the histamine. Histamine generally produces allergic reactions. Next, angiotensin. So the name itself indicating angio means blood vessel and it increase the tension on the blood vessel. Generally, angiotensin increase the increase the blood pressure. So based on that, it is called as angiotensin. Next, serotonin. Serotonin acts as a neurotransmitter in the CNS as well as peripheral nervous system. Next, platelet activating factor. Platelet activating factor is name itself indicating it activates the platelets during the clotting process. Next, endothelins. So endothelins, the name itself indicating they release from the endothelium. Endothelium is a lining layer of the blood vessel. So endothelin work is it causes vasoconstriction. So in the body, number of vasoconstrictor substances are there, but endothelin is the most potent one. So the hypertension intensity, the degree of hypertension caused by endothelin is more than angiotensin 2, is more than noradrenaline also. Okay, next nitric oxide NO as well as neurotensin. So neurotensin is a generally neuromodulator. It can modulate its action based on the situation as well as based on the tissues. And nitric oxide, nitric oxide is also called as endothelium derived relaxing factor, EDRF. So this nitric oxide as well as endothelin both are released from the blood vessel lining layers itself, that is endothelium. But endothelin causing vasoconstriction and the nitric oxide is causing vasodilation. So this is EDRF, endothelium derived relaxing factor. So nothing but the EDRF is other name for nitric oxide. The nitric oxide is a potent vasodilator in the body, like prostaglandins. Even prostaglandins also produce vasodilation. So nitric oxide means NO, nitrous oxide means N2O. N2O, you know, it is a laughing gas. And apart from this, nitrous oxide is a general anesthetic agent. So in the general anesthetic classification, you will go through it. Nitrous oxide N2O is a laughing gas generally. It is a general anesthetic agent. And apart from that, nitric oxide NO is a potent vasodilator in the body. Okay, so these are the examples of commonly studied autocoids in the body. Nothing but common autocoids you can find in the pharmacology subject. Okay, we move forward. So after this definition as well as example, next, what are the characteristics of autocoids? So what are the general characteristics of the autocoids? Just a minute. So here, the general characteristics of autocoids are they are endogenous compounds. So they are produced within the body. They are produced within the body. So that's why they are called as endogenous compounds. And plays a important role in physiological function, normal functions, as well as pathological process or condition. So they are having their actions in the physiological general functions of the body and during the diseased conditions also. So some autocoids may produce the diseases like inflammation, other diseases. Some autocoids may heal the diseases. So they involving in the pathological process. So pathological nothing but diseased states. And they have the short half-life. They have the short half-life. So they shows action immediately and they show nothing but they terminate immediately. They inactivate immediately. Once action completed, they inactivate immediately. Next is they exhibit local action. Apart from that, they also exhibits the local action. So as we already know, these are also called as local hormones because they shows action locally. So where they released, where they secreted, they show action near to the site. Okay. So this is the simply characteristic features of the autocoids. And next, so after the characteristic feature, we will go through functions. So generally, what are the functions? Physiological role. So what is the physiological role of the autocoids? So regarding physiological role or functions of the autocoids, let's see. Just a second. Okay. So here, first one is inflammation. The first function is inflammation. So generally, some of the autocoids may provoke, may increase the severity of the inflammation, like prostaglandins, like histamine. So the substance like autocoids, they may increase the inflammation. That is in the diseased condition. So first one is inflammation. Next one is anaphylactic reaction. So rarely these anaphylactic reactions will be produced. I hope you know anaphylactic reactions. So anaphylactic reactions means simply severe form of the allergic reaction. Especially the autocoids like histamine action is more in the anaphylactic reactions or allergic reaction. That's why in anaphylactic reactions or anaphylactic shock, the first choice of drug is adrenaline. ADRENALINE, adrenaline, nothing but which is also called as epinephrine. So what is anaphylactic reaction? It is a severe form of allergic reaction, which is a dangerous and emergency condition, require the treatment. So the first choice of drug for anaphylactic reaction, severe form of allergic reactions is adrenaline, because adrenaline is a physiological antagonist of the histamine. It reduces the histamine actions in the severe form of allergic reactions. So apart from that adrenaline, we can use glucocorticoids, we can use antihistamines in the anaphylactic reactions or anaphylactic shock, which is an emergency condition. We have to go for the treatment. So next is neurotransmission. So some of the autocoids are involving in the neurotransmission like neurotensin as well as serotonin. Next, gastric acid production. So histamine is one of the autocoid involved in the gastric acid production. And I hope you know, especially due to excess production of acid, it leads to ulcer. In the ulcer, we are using H2 receptor blocker. So increased H2 receptor action in the GIT, over expression of H2 receptor in the GIT leads to ulcers. That's why we are using antacids, nothing but anti-ulcer drugs as a H2 receptor blockers, like cimetidine, ranitidine, famotidine, nizatidine. Number of drugs are there. Next, neuroendocrine regulation. So some of these autocoids are also involved in the regulation of neuroendocrine system, that is interlinked between nervous system as well as endocrine system. And as we know, some of the autocoids like histamine generally involves in the allergic reaction. It can increase the allergic reaction between antigen antibody reactions. So number of processes there. So generally autocoids are also involving in the allergic reactions. So this is general functions of the autocoids. And after the functions of autocoids, so this is regarding generally peripheral as well as CNS. In the CNS, these autocoids are having some separate functions. So let's see what are that functions also. Okay. So here in the CNS, they are responsible for the functions like wakefulness. So they are promoting the wakefulness. So they're preventing the sleep, and they're promoting the wakefulness, and they're reducing the appetite. So they're reducing the feeling of taking food, reducing the appetite, and regulation of drinking, regulation of temperature, secretion of ADH, antidiuretic hormone, control of blood pressure, perception of pain. So by acting on the central nervous system, so these autocoids are regulating these like actions: perception, sensation of pain, controlling of blood pressure directly from CNS, secretion of ADH, antidiuretic hormone, which is also called as vasopressin, and regulation of temperature, regulation of our drinking also, and regulation of our food behavior, nothing but decreasing appetite, and the wakefulness, promoting the wakefulness, and reducing the sleeping behavior. So simply, these are the roles of autocoids by acting on the CNS. So after that, the thing is classification. So already we studied brief introduction regarding the autocoids and what are the functions in peripheral as well as CNS, and what are the examples. And now the classification is based on the chemical classification, because in competitive exams as well as your theory semester exams also, in MCQs they will ask like this. So the classification of autocoids based on the chemistry. Okay. So this is a simple classification. So the mnemonic is LAP, L-A-P. L means lipid, A means amines, P means peptide. Though the examples of lipids like leukotrienes, thromboxanes, like prostaglandins, and examples of amines like histamine, like serotonin, and examples of peptides like plasma kinins, like vasopressin, which is also known as ADH, antidiuretic hormone, like substance P, which is also one of the new mediator involved in the inflammation as well as pain, and angiotensin. So this is the chemical classification of autocoids, lipids, amines, peptides. So this is regarding our discussion regarding autocoids, and always keep update to our channel. So please like, comment, share. Thank you.